This story is set in Melbourne in 1875, when the rivers of gold were still flowing from Ballarat and Bendigo in mid-Victoria, making Melbourne one of the richest cities in the world at that time. Now, as you know, Brisbaneites, it's regarded as the most livable, but it certainly was not the most livable in this period. Next, thanks. Oh no, just stay with that. David designed the cover, and my daughter Kate, where are you, Kate? She did the illustration. Kate's a Brisbane artist and an art therapist. So if you need some help today, now it concerns this controversial, very colourful surgeon called James Beaney, who was born in Kent in 1828. He started off working for a pharmacist, and then he was an apprentice to a surgeon, was encouraged to do medicine, started studying, but got the tuberculosis, which in those days 40% of the working population got TB. So he was told to come out to the warm climate. He came to Melbourne instead of Brisbane. And in 1852 he started working again for a pharmacist. He recovered and he went back to England. Next slide. And he obtained a diploma in surgery, a diploma first of all, and he came back to Melbourne, and he was fortunate enough to do a locum for this Dr Maund in Collins Street, who died about a year later, so he immediately had a large practice. Next. Physically he was short and described as podgy. Those who didn't like him said that his blue eyes were shifty. His hair rose up on each side and they looked like horns. He was always very neatly attired. Anyone who knows shopping in Melbourne, he used to go to George's. The George brothers were the senior tailors in Melbourne at that time. Next. He went back to Edinburgh and obtained a surgical fellowship, and then he came back to Melbourne, and the £14,000 it was said that he earned in those times was more than the retired chief executive of Australia Post got. Do you remember the figure he got? Many millions of dollars when he retired very recently. So that figure of 14,000 would be 30 to 40 million dollars in today's terms. Next. And he wore this richness in his outfit. He had a gold watch and chain, diamonds and ruby rings, and when he operated, he put on a none too clean white coat over his vest, and he still had the rings on his fingers. And in those days, surgeons did not wear gloves when operating. Next day. He was known to like champagne. He had it for breakfast, lunch and dinner.
What's wrong with that?
He described it for his patients. And at the end of an operating day, he would share a bottle with his residents. Next. The press knew about it and they called him Champagne Jimmy. Now, in 1864, a young woman died, and it was thought that she probably died from rupture of the uterus after an abortion. And he was charged with her murder. He endured 2 trials. The jury couldn't agree on the first one. On the second one, he was acquitted. But the publicity was poor for him, and he lost his hospital appointment. Next. However, it did not stop him operating, and he had built this 4-storey mansion on the corner of Swanson, on the corner of Russell and Collins Streets in Melbourne. It still exists today without that little tower, and it's the house of Louis Vuitton. Next. Now, he wrote a lot, and was probably not the author of a number of volumes that he declared were his. Don't assure you, but no one like that. He advertised widely and was re-elected to the Melbourne because in those days the public elected the doctors who would look after them in the hospital. Strange as it seems. Next. At the end of this same year, 1875, when he's re-elected, he operated upon a man who had a very large bladder stone, and he endeavoured to get it out intact, which he did. Operation successful, but the patient died several days later of infection. Now, unwisely, he made a cast of this stone, next, and he put it in the window of a shop in Collins Street, together with a stone he'd removed the year before from another patient. Now, next, an irate surgeon saw this display and wrote a very aggressive letter to the Argus newspaper, which was then one of our dailies. And in it, this surgeon, who didn't put his name, he said that Beaney had done the wrong operation and the man had died from peritonitis and could have been avoided. Now, the Minister for Justice saw this letter and decided that there had to be a police inquiry, and when the police interviewed the resident doctors said things like, oh, he used terrible force, oh, he went on for far too long, it was a shambles. So the police report wasn't a very favourable one to Beaney, and the coroner said we must have a post-mortem on this man and then an inquest. Now, it was the holiday period for 1875. He couldn't find any doctors to do the post-mortem on Christmas Day except for 2 university lecturers. I suppose they needed the money. Next. Now, Beaney was facing murder again or manslaughter, and he was allowed to be represented at the inquest. His lawyer couldn't find any of the well-known barristers in the city and came upon this young man called James Purvis, knowing that Purvis could be very aggressive in court and would upset the judges. But his lawyer didn't tell Beaney that, and so Purvis was chosen to represent him. Then there was a long inquest. Come back one, I think. Yeah, okay. I thought I wouldn't tell you anything about the inquest, make you read the book. Next name. But Purvis did show that he had, within a matter of days, a great knowledge of this operation and was able to critically analyse the position and make mincemeat of the witnesses when they came along. Next. So the jury found no evidence that Beaney had been neglectful, and he was exonerated. They thought that the only thing they could put down that Beaney should have done was to have had a consultation with his colleagues before the operation. And so that was called Rule 7, and he had broken Rule 7. But that didn't mean much to him, and so he celebrated with his colleagues after he was Next. Now, the newspapers were very favourable to Beaney, but the medical journals were not. They considered that he still had not done a good job. Next. There was a very big celebratory dinner in his name, put on by the Lord Mayor and all the big men in the city. Next. This is an older version of the slides. I sent you a briefer one, but it doesn't matter. I've still got plenty of time. Now, why did this man Birth die? Well, he probably did have septicemia or blood poisoning, and he had poor kidneys to start with. And any time there's any instrumentation of the urinary tract, there's a danger of bacteria flowing through the blood. In 1875, there were no such things as antibiotics to help the patient. So probably he would have died anyway. Next. The practical surgeon's identity, the man who wrote this letter that sent Beaney on to have the go through the inquest, his identity was never known. It was probably Dr. Edward Barker, who had been displaced by Beaney in 1875. Barker himself had displaced Beaney in 1865. So Beaney was getting his own back, and this man thought that he would write that letter to the paper to push Beaney off the hospital staff. Next. Was he a good surgeon? Probably as competent as most, but not the best surgeon that one could go to. And as you know, Matty, you've got to ask around when you want to go to see a surgeon. You don't just look up the big pages, the yellow pages now and decide. Next. He died in 1891, and it was said that he died of a cerebral condition complicating liver disease and gout, confirming that he had imbibed too much alcohol in his lifetime. Sadly, his wife had predeceased him, and he had no children. Next. When you go into the Melbourne General Cemetery, this giant monument dwarfs all of those for about 100 metres around. Next. He gave grants to the Melbourne University. There was a Beaney Prize in my day. I didn't win it. They are now scholarships. He was the first benefactor to Melbourne University Medical School. His estate, if I said his income yearly was high, the 60,000 would be several hundreds of millions of dollars in today's terms. He left money to some Melbourne hospitals, but most importantly to the city of his birth. He gave money for the restoration in the Canterbury Cathedral, and on your right, down below, the plaque bears his face, and above the theme is the Good Samaritan. And in the High Street in Canterbury still lives the Beaney. He left money for the establishment of an institution for the education of the working man. A few years ago, the Canterbury Council spent £14 million on refurbishing this building, which is now known as the Beaney House of Art and Knowledge. It's an art house, a museum and a library, known locally as the Beaney. So, in Canterbury, my friend James Beaney sits with the angels, whereas in Melbourne, I think they would have rather thought that he supped with the devil. I won't worry about the Melbourne Hospital, that's another intrigue of his. I'll just read a little, I've got time, from the beginning of the inquest. We can turn that off, thanks now. The inquest commenced on the Wednesday morning at the morgue, then situated near Prince's Bridge, on the corner of Swanson and Flinders Street. Those who know Melbourne, Flinders Street Station's just across where the morgue was in those days. The building had been erected in 1871 and served the city until 1888. This prominent location was chosen for a number of reasons, chief among which was that it was close to the Yarra River, from which so many bodies were removed and taken into the Swanson Street police station. Before its establishment, bodies used to be stored in hotels, and the licensee would be paid £1 a body. The inquest would be held there in the hotels. Melbourne was ahead of London and New York in establishing a morgue. The only precedent at that time was a purpose-built facility in Paris called La Morgue. The fact that Melbourne was ahead of London and New York is probably less indicative of good foresight and planning than it is of a level of need through the lawlessness and the great variation in wealth distribution in the rapidly growing community. Now, the coroner, Dr Yule, presided at the inquest. Inspector Green, Sub-Inspector Sectron, who would 3 years later be chasing our Ned Kelly, and Detectives Duncan and Gould were present for the Crown. Mr Purvis, being instructed by Mr Duffett, appeared on behalf of Dr Beaney. The men of the jury having been sworn in, and before they were sworn in, they had to see the body which had been exhumed after being in the grave for 3 weeks. The skin was peeling and half of them fainted. It took some time to get them back in. The coroner then addressed them on the background of the case being an inquiry as to the cause of death of Robert Birth at the Melbourne Hospital on December the 5th, 1875. He then went on to outline that Birth had a bladder stone for which he'd undergone an operation on December the 2nd. The coroner stated that following the patient's burial, nothing was heard of the matter until roughly 10 days later. Then, there was some disconcerting correspondence in the papers and a particular letter in the Age of December the 20th, signed a practical surgeon, called the attention of the Minister for Justice to the manner of Birth's death. He outlined briefly the police inquiry that then occurred, leading to the exhumation of the body. He was honest enough to indicate that Doctors Barker and Neild, who together performed the post-mortem, had not been his first choice for the task, given the constraints of the holiday period. Nevertheless, he believed their qualifications, experience and positions at the university provided reassurance that the autopsy would be appropriately conducted. He would have known, but did not add, that Mr Beaney had replaced Mr Barker. Doctors in those days, the surgeons were called Mr, after the Barber Surgeons Guild. The tradition was that the real doctors were physicians and surgeons were no better than barbers who did bloodletting. So that's why when you go past a barber shop, you see the red and white bandage going up the pile. Bloodletters. That's what surgeons are. So he would have known, but did not add, that Mr Beaney had replaced Mr Barker in election to the Melbourne Hospital earlier that year. He didn't want to let the bias be evident. Now, I wrote most of this more than a decade ago, and I put it aside until I would have more time and could devote more effort to it, and all the writers here will know time and effort are essential. When a young writer died, because of her youth, she was given the opportunity to have a glimpse of both heaven and hell. She was taken down to hell first, and there she saw row upon row of authors chained to their desks, sweating as they tapped away on their laptops, with an overseer periodically whipping them. Oh dear, she said, can I see heaven? Up she went to heaven. There, to her dismay, she saw row upon row of authors chained to their desks, sweating as they tapped away on their laptops and being periodically beaten by an overseer. Oh God, she said, I think you heard her. This is the same as hell. It's no better. Oh, yes, it's better. Up here, their work is published.